And then here's the last one I just want to put up with to you that I'm sure you know this, but so autism spectrum disorder has two main categories, right? It has the persistent difficulties in social use of verbal and nonverbal communication, right? And then it has the repetitive restricted behaviors. So social/pragmatic communication disorder is really half of ASD. And there's very little that's really written about how to treat it. And many people, when they do different cluster analyses, really even question whether this should be a separate diagnosis or whether it's really kind of high-functioning autism spectrum disorder with just lack of prominence of those repetitive restricted behaviors. So if you go back and you read what I wrote in this vignette, it's really all focused on these social communication difficulties. I didn't really include anything there suggesting restrictive or repetitive kind of behaviors or interests. So really the most likely diagnosis, kind of primary diagnosis this patient has is social communication disorder. She could have ASD, of course. So I just throw this up there for you to kind of remind you. So that's the end of this lecture. I hope you found it helpful, useful. Again, feel free to reach out to me with questions or concerns.